president yesterday said this continues to be a pandemic of the unvaccinated. Isn't it also fair to say that it's still also a pandemic of the vaccinated, given the breakthrough cases that we've been seeing?
Well, Jackie, we also know that you are 17 times more likely to die of COVID if you are not vaccinated, and 20 times more likely to be hospitalized. So I think in terms of the impact, the dire impact on people across the country, we should be very clear about the impact of not getting vaccinated and the people who will be hurt, be hospitalized, and face the threat of death the most. And those are the people who are unvaccinated.
One last question on the CDC announcement, rather the COVID briefing announcement. The CDC is not going to change its definition of fully vaccinated to include a booster shot. Jeff Zients and Rochelle Walensky said there's no plans for that. They didn't explain, though, why that is. Can you give us some context on how that decision was made?
Again, I would say that's a decision made by our health and medical experts. They conveyed the technical definition. As you said, a fully vaccinated with COVID-19 has not changed. Someone is considered fully vaccinated if they receive a primary series of vaccines. They also clarified that CDC recommends people stay up to date, as everybody should stay up to date on any vaccine. If your kid needs a vaccine, when you go to the pediatrician and they say you got a 5-year, a vaccine at 5 years old, you kind of hold your breath because you don't want to have your kid get a shot, but you keep it up to date, and that's what they're recommending. But they can speak to their own decision making.
I wanted to start with Chicago. Can you tell us if the White House or the Education Department or the administration at large is doing anything to help get teachers and students back into school there?
Well, we are across government. We are in regular contact with a range of stakeholders on the issue of school reopening and closures, including superintendents, state leaders, principals, teachers, parents, and other school staff. And that is certainly the case now, today, this week, as the president is working, and we are all working to keep schools open. As the president said yesterday, he wants schools to be open. We know they can be open safely, and we're here to help make that happen. And he agrees with medical, scientific, and education experts that because of the historic work we've done, we are more than equipped to ensure schools are open. And we're going to keep our children and educators who selflessly serve their community safe, but ensure that children are not enduring the mental health impact of not being in school, that there are not gaps in learning. This includes schools everywhere, including in Chicago. Fortunately, 96% of schools are doing just that. And just as a reminder, and I know I touched on this yesterday, but the president and our administration foresaw early on that schools across the country would need additional resources. That's why he fought for $130 billion in the American Rescue Plan for funding to schools to implement mitigation strategies, including $10 billion for testing, which has already been distributed to states. And the Department of Education has also been providing technical assistance and resources for months now on everything from implementing mitigation strategies to connecting schools with testing providers, hosting vaccine clinics, and addressing pandemic related mental health issues. So long story short, we want schools to be open. The president wants them to be open, and we're going to continue to use every resource and work to ensure that's the case.